There are no confirmed Minnesota cases, but state health leaders are not taking any chances.
We want to make sure that we're doing everything we can to minimize transmission.
Chris Erzman, the state's infectious disease director, outlined their preparations in response to the coronavirus.
It's very likely that COVID-19 could actually affect our daily lives as Minnesotans.
Thursday, she said health leaders are revisiting their pandemic plan and potential measures that would be taken here should the virus make it to Minnesota. Chris says if there was a case here, that person would be isolated and there would be a quarantine situation. She says depending on the specifics of that case, action could be taken.
Would we think about closing schools? Would we have to cancel public gatherings? Would we ask faith communities to focus on, say, a video service?
She also encouraged people to prepare now. Stock up enough on supplies, stay home if you're sick, wash your hands, and cover your coughs.
Those are all simple things that we can do, but that will make a big difference in reducing transmission.
Now, state health leaders say they've also been in touch with area businesses and schools to start thinking about those preparations. As far as a special facility for this situation, no plans for that as of right now.
All right, thank you, Alex.